Okay, here finally to continue the last bit of the urinary system. So I left off looking at the idea of the nephrons. We look at how there's three aspects with the nephrons. One, we have filtration, right? So that's the movement of blood from the glomerular capsule, from the glomerulus to glomerular capsule. So filtration, plasma converting into filtrate. Now we talk about tubular reabsorption. So that's now within the actual nephron, the proximal convoluted tubule, the loop of Henle, the distal convoluted tubule. Now we're re-extracting some of those good substances back. Right? And then we change our mind. So what we absorb back into the blood now can be forced out once again through capillary pressure. And basically that's what we then term as tubular secretion. So at that point, once we're that far within the nephron, we start to talk now about another name, right? So we went from plasma to filtrate. Now we talk about urine, right? So urine is basically this filtered fluid that is clear, pale to deep yellow, depending on hydration. If you're well hydrated, it's transparent. If you're dehydrated, if there's all these dissolved aspects, it's going to be more yellow. If there's some sort of urinary tract infection, it will be cloudy, right? So that's, again, this liquid now that's in the collecting tubules, the collecting ducts, which will then go into the minor calyx, to the major calyx, and then to the, excuse me, to the pelvis. Sorry, so the renal pelvis. So when we're talking about the urine formation, urine, everybody knows urine, I think. So slightly aromatic when fresh, that's how the book defines it. Develops an ammonia odor as it starts to decompose. So the smell of the urine can be altered by certain drugs. Asparagus, some certain vegetables can give it a very characteristic odor as well. Slightly acidic, pH of around 6, range 4.5 to 8, which can be affected by body pH as well, right? Specific gravity, which we didn't do, and we would have done in lab. Chemical composition. What is urine, right? Well, urine is basically water, right? It's 95% water and about 5% solutes. Those solutes are going to be things like urea, uric acid, creatinine, these different nitrogen-based substances that our body is trying to get rid of. The normal solutes, a bunch of ions. Abnormally high concentrations of any constituent may indicate pathology. So it should always be around 5% solutes. Once we start seeing very high amounts of solutes, then we know something's not quite right. So we made it finally to the renal pelvis and then to the ureters, right? So the ureters will convey urine from kidney to bladder. They enter the base of the bladder through the posterior wall. And I'm not going to get into the different tunics again. We have a very similar anatomy in the tunics, from the vessels of the blood to the GI tract, now to the vessels of the urinary system, right? Same kind of idea. We have that tough outer coat. We have the muscularis layer that's going to be involved in peristalsis, and then that sort of lumen lining internally. There's the lumen. You can see it's very sort of collapsed there. That tells us that it has the capacity to really fill up and stretch out. Personally, I've never had a kidney stone. I don't know if you have or not, but I hear that they are just immensely painful. We call them technically renal calculi. Calculi is difficult, it's hard, dense. That's why calculus is a hard class, I guess. Huh? But kidney stones. Kidney stones are going to be these little stones that sort of form here, and depending on the type of stone, they can be calcium, magnesium, uric acid salts. They're crystallized aspects, which means they're sharp, jagged edges, and you have this very solid, sharp, jaggedy, little dense mass that's traveling through that little lumen, scraping and compressing, and the more that the kidneys stretch, the more it's contracting on that sharp crystalline object. So yeah, I can imagine that can be quite painful. Yeah? So traveling the entire length of the ureter. Now, some people even have stones that form within the renal pelvis or one of the minor pelvis, the minor calyx within the kidney itself, right? So these, again, if they're going to be able to be passed, those can typically pass without too much issue. If the stone gets blocked in the ureter, it causes pressure, backflow up into the kidneys, and it can be quite problematic, right? So renal stones, kidney stones, renal calculi can be due to chronic bacterial infections, urine retention, high calciums, right? High levels of calcium, chronic states of dehydration, things like that can cause these calculi to form. So assuming there's no kidney stones, the urine makes it very easily to the bladder, right? So it's this muscular pouch, this muscular bag for the temporary storage of urine. We're going to talk about the prostate gland when we talk about the basis of the ureter and how that's going to link back to the system. And we'll see that later in another discussion on the reproductive system, right? For now, let's focus on the bladder. The bladder, basically, we're going to talk about 3 openings, right? There's 3 holes to the bladder. Right? And if I had to come up with the design, I'm not an engineer. I guess that's why I'm not an engineer. I would think, well, let's put one of the openings here on the top for the right ureter to enter, another opening for the left ureter to enter, right? That's where I would put it, but that's not the way it works, right? Because of the way that that bladder can expand. I guess it would cause a flexion, a pinching off of the ureters. So instead, the ureters go all the way to the bottom and enter the bladder from the bottom. So we have this 3-hole area that we call the trigon. Right? So there's a hole, the entrance of the right ureter, entrance of the left ureter, and then the exit of the urethra here. So that's what we talk about, the trigon, right? The trigon is this triangular area where there's 3 openings, 2 bringing urine in, 1 sending urine out. The bladder itself can expand and contract, again, depending on how much liquid there is in there. And the previous slides kind of mentioned the idea of an infection. If there's some sort of urinary tract infection, because of the design, if that infection is here, that infection can proceed pretty easily. Doesn't take too much distance to travel then to get into the ureters, and then it can now start to work its way up the ureters. So again, the system is a little bit different, right? Well, not different. The design of the system allows for an easy infection up the system, the way it's designed now. So here we're looking at a female with a very short urethra. Right? It's the anatomy of a female system. The urethra then being this muscular tube that's designed to secrete the urine out of the body. We see this again and again and again. We saw this with digestive system. We see this with circulatory system. We see this idea of sphincters, right? Sphincters that allow then for the contraction around these tubular vessels. So we have internal urethral sphincters, involuntary, and the external urethral sphincter, voluntary. So very similar to the design of the rectum, of the digestive system, right? Same kind of idea. You have voluntary control up to a limit. Once there's too much stretch, too much forcing of the bladder, urination is going to happen whether you want it to or not. So we talk about the urethra in females. It's very small, right? 3 to 4 centimeters, very short. And yeah, very short little idea there. And the males, right? The males is going to be a little bit more complicated because of the reproductive role that the urethra plays as well. So the male urethra is going to go through 3 areas: the prostate, the membranous area, and then we're going to have the spongy urethra. So whereas the female urethra is very short, 3 to 4 centimeters, the male urethra is going to be longer. And I have a picture here of the guy that sells propane and propane accessories, Hank Hill, right? I don't know if you know his story, why he only has 1 kid, Bobby Hill. If you know the story of Hank Hill, he has a narrow urethra. So that's where this comes up in popular cartoon culture, I guess. But narrow urethra, so he had a hard time passing sperm through that narrow urethra, right? And I'm foreshadowing to what's going to come. The urethra in males is going to be part of 2 systems, the urinary system and the reproductive system. In females, the urethra is only going to be involved in the urinary system. There's a whole separate set of canals for the reproductive system. But we'll get to that in the next chapter. So again, there's a trigon. There's our ureters coming down from the posterior side. As the urethra passes, it passes through the prostate. Right? We have the membranous urethra and the spongy urethra. So all of these are components of the urethra in males, which differ from the urethra in females. And we're almost done here, right? So when you got to go number 1, when you got to go pee, you see, we're so used to this that it happens very easily, right? And micturition is what we term of as urination, right? Urination is the basically the common word that we use. The technical term is micturition. So there's a sort of a sequential coordination that happens here with the muscles, the sphincters. So again, it's a little bit more complex than what you may think of. Yeah, this is why it takes us a while as infants to learn how to control urination, and this is why as elderly Alzheimer's patients, Parkinson's patients, they sort of lose that control as well. Yeah? So with that, that's, I think, sufficient now. You should have enough information to complete your homework assignment on the what's going to be assigned for the urinary system itself. Right? So a lot of details. I didn't get into all of the chemistry, all of the osmolarity. It's a lot of stuff to cover chemically based on the urinary system, but we'll call it okay for now there. Yeah. So with that concludes our day of discussion. These will be available today. Keep an eye out tomorrow for the final sets of discussion, which are the reproductive discussions. Yeah. So with that, you'll have a good day, and I'll be seeing you again tomorrow.